sometimes people get so afraid of damaging their baby, they don't touch their baby.
Okay.
Like, you don't have to isolate from your babies. What I'm saying, you know, that's important too. Sometimes people try and isolate their siblings from a baby for like 3 months, and I'm like, it's just not possible.
But actually, during COVID, do you remember it was so like, oh, you isolate yourself from your family if you have? Do you remember at the very start? And I had people messaging going, really, do I actually have to isolate myself from my children? And I was like, I'm like,
they're probably already infected.
Yeah, exactly.
On that thing about bringing the baby into hospital, they've a ghost story. One thing that maybe people don't know enough is that if their baby has a fever before they're 2 months old, just bring them into us in hospital.
I thought it was before they were 3 months old, actually.
Yeah, before 3, and then we've said before 2, 100%.
Yeah.
Before 3, bring them to see a doctor. But I think if you're under 2 months old, it's straight to jail.
And why is that? Can you explain why?
Because their immune system isn't well developed, and they're at risk of meningitis and sepsis and like serious bacterial infections that they don't really declare. Like, they don't say, hey, I'm really sick.
Yeah, they just cry and you don't know what's wrong. Dr. Emer Ryan, what a pleasure it is to have you here today.
Thank you. Thanks for having me.
Thanks for giving me your time. Loads of questions in. General paediatrician seems to be quite a popular person. Actually, do your friends just love having you around? Or are you just beeped all the time?
I get a lot of WhatsApps, and I'll get pointed questions that are definitely directed at me within the mum's WhatsApp chat. Like, what? Well, I do. She has a temperature, which is kind of, I'm expected to answer that one, you know. Like, but I suppose in the last 10 years, because everyone now has a child.
Yes.
For sure.
And then like pictures of rashes and stuff. Do you get that?
Yeah. I get rashes. I'll get, sorry, this picture of my baby's bum. Get a little bit of that.
Yeah.
Yeah. A fair amount. Not an annoying amount. Like,
no.
I'd always...
You always answer. You don't just want to answer. You don't just leave them unread, do you? No. Unread. Like this cow. So can we talk a little bit about your work and what you see in general as a general paediatrician in a hospital? Where do you work and what do you see coming in the door?
So I work between Temple Street and Tala.
Okay.
So Tala Outpatients Department. So I have like clinics are mostly based out in Tala, and then my inpatients, the kids that come through the door on a daily basis, they'll come under a general paediatrician's care. And they might have, so if you walked in the door of A&E in Temple Street and were to be admitted, you might be admitted under myself, and then have, we might have specialties, subspecialties then that might need to consult on a patient. So
okay.
I see, so as inpatients, you'll see the pneumonias, kidney infections, seizures, funny turns, anorexia.
As in anorexia nervosa or anorexia?
Oh, anorexia nervosa,
okay.
Yeah. So we'll have the medical stability, like stabilising a patient that's now too unwell to be managed in the community. They'll come under hospital care.
Okay. And is there much of that?
There was loads during the pandemic.
Okay.
Yeah, but there is probably more than there used to be.
Okay. And would that be attributed to the pandemic having happened, or social media, or?
Anxiety had like kind of unmasked, I suppose, children with anorexia because their anxiety was heightened during the pandemic.
Okay.
And then there's just more anxiety, I think, in children than there previously was as well.
Okay. And what age are these children that are coming in with anxiety?
When I come in on take and I look at the age range of the children I'll have taken in might have a baby that's a few weeks old up to 16 years old. After 12, I'd be surprised if they were in with a medical problem, almost. It would be unusual. Like, you kind of expect them to be like a suicidal ideation or anorexia. So the joint care with psychiatry. So there's been a lot more of, I suppose, that recently. So...
Is it difficult to get these children looked after, though, once they come under you? Is it difficult to get them psychological support and psychiatric support and those kind of things? Because we're always hearing about how mental illness in Ireland there's serious deficits there in care for kids.
Like camps, yeah. So I think the problem is that these it's not my care, but the care that we've a PEDS psychiatry liaison service within CHI. So they do all of the psychiatry work, and they're probably more overwhelmed now because there isn't community services. Okay. So they might be seeing children that should already have had their needs met in the community that shouldn't necessarily have been hospitalised.
Okay.
But I guess the Children's Hospital is the place where children who are in crisis get admitted in the first instance before they can then step down to community services.
Okay. And do you see kids, is it up to 16 or is it up to 18?
So it's up to 16 in Ireland. And when I worked in Melbourne for a year, and it was up to 18 there.
Okay.
And I never thought it was like, a big difference between a 16-year-old and an 18-year-old. But God, in Melbourne, I was like, what are these? Like, huge adults,
They're walking in.
So yeah, kind of, and then I'd always said, well, we should really see them up to 18. In Ireland, once you turn 16, if you're not under the care of someone within the children's service, you have to go to the adult services. So there will be an exception for kids who are still seeing a specialist.
Okay.
But it is the group it's really tricky for the children with intellectual disability and neurodisability, like that group of children. It's really hard for their families to move on, having been coming into the children's hospital, then to be bringing what's still in their eyes, their child, into the A&E and the Mater. Like, it's just, I imagine, a big shock to them.
God, yeah.
So,
that must be terrible.
Yeah, and I suppose the culture in a children's hospital is very different, I suppose.
I've been there a few times with mine.
To an adult.
Generally just splitting their heads open and stuff because I have 3 boys.
Yeah. The girls split their heads open too.
But not as much. I remember when one of mine did it, they've all done it, and the paediatrician there said, and it's, 80% boys in here getting patched up.
We had, I brought my youngest in about a few weeks ago, and that was her first visit. That was her split head.
Okay.
But actually, it's probably your brother's fault. So
always a sibling's fault.
But still, yeah.
What areas of special interest do you have when it comes to looking after kids and general peds?
So my PhD is in concussion. So I like looking after those children. I like the small babies, the failure thriving ones.
Who doesn't? The brand new ones?
The feeding ones. Well, we don't get the brand new ones. They belong to neonates. So we get them once they're 7 days old.
Okay.
So, yeah, I was very conflicted. I wondered about doing neonates for a long time as well.
Okay.
I like when they're able to talk back to you too. The 3, 4, 5.
Yeah. Sorry,
you're talking about age groups here. You're talking about kind of age.
No, it's interesting, but I think it seems like you like all kids.
Yeah. In clinics, we get a huge amount of children with constipation. That is.
Oh, yeah. And why is that? Diet?
But a lot of it is psychological. You have control over your pooing when you hit the toilet training age. And some people just don't like to poo. And they really and they don't like to poo, say, in school. So they prefer to hold it and become constipated. Not they prefer to become constipated, but often these children, if you dig down and they're in school, there's no way they'd go to the toilet in school.
I actually did a poll recently about that, asking adults if they had issues pooing in school, and a lot of them said they had. God, I remember the toilets in school, though, they were vile.
But there are some,
if you need to go,
there's adults who will only poo in their house.
Yeah, I know. Actually, I got a message in from a woman saying she actually drove home, like an hour and a half drive home from somewhere, and would not stop on the way because she just did not want to go anywhere. And
yeah, and often you'll find these kids have a parent who are like, that they're exactly the same way.
Okay.
So, and then there's a kind of a sensory kind of thing to it. Like there's a lot of people have kind of sensory issues about touching, smelling, doing a poo or eating. There's children with autism who have sensory issues about lots of things. There's lots of people who don't have autism but have sensory issues around the idea or the smell or the touch. There's some children who don't like to wipe their bottom. They don't touch it. So they end up, it's more, and it's hard to convince parents at the beginning sometimes that the reason they're constipated is not because their bowels don't work.
Yeah.
Or that they're going to become stuck on medication. It's like we need to give them kind of laxatives to make the poo soft, to make them poo so that they get into a habit and we get them into a routine of kind of going daily. And it's actually quite a lot of work in that.
Do they turn up and they're actually impacted?
There might be 12 sachets of Movcol for a couple of days. We do admit children to hospital to disimpact them.
Do you have to manually do it sometimes?
No, that would never be done to a child.
Because it's done to adults. Because I have a friend who works in an ED and she says she remembers doing it to an adult.
Yeah, but with children, that wouldn't happen. Like anything that was going to be done that's a bit nasty like that would be under anaesthetic. But that's never what happens. You can generally from the top down.
But even, the way sometimes if it's so compacted
Yeah,
and
that they
dried up
need
to and actually the Movicol will come out around it and come out as water almost.
Yeah, like the rock.
Yeah.
Yeah, no, then they'll have laxatives as well. So you might end up with like a week of a child. We've had children in hospital a week emptying out months of poo.
Can you imagine the relief that they're getting as well?
You have to kind of keep totally on top of it or they go back into that vicious cycle of preferring not to poo and having to be encouraged.
And are they generally released then with a prescription for a laxative to keep them going?
Yeah. You need months to shrink down, like a rectum that's been blown up with poo. They're not going to feel that stretch.
Are big.
They'd be, I remember a child when I was working in A&E and I felt his tummy and I went, oh my God, this guy has tumour.
Yeah.
And I was like so shocked. And I got the consultant to come down and have a look at him. And he had the size of a rugby ball worth of poo. And it was so, like, that's how constipated he was.
Oh my God.
So yeah, I don't know, poos are a big deal. There's...
Yeah.
And I spend a lot of time talking about poo. Yeah. But actually there's a lot of kids who are so weird about pooing that they need poo exposure. Like they need poo jokes.
Yeah.
Poo, like, stories.
Yeah, because a lot of parents would maybe, you know, the way you'd think, oh, maybe the parents don't poo in front of them. And if you just poo in front of your child and make it all normal, it's fine. But then parents say, no, actually I do. We've no problems pooing. It's not the child themselves just doesn't like it or doesn't go. It's
like kids who are picky eaters. It's like the other end version of the not liking stuff in their mouth or not liking, you know, a sensation or a feeling or...
Yeah.
There was a little boy in clinic today say that, like, I was like, he would love if he just didn't ever have to poo. You know, you know, it's just something they don't like doing.
Okay.
You know.
And what can parents do then before they go to you?
Sitting out in the toilet. So they need to go on laxatives if they're totally bunged up. If they're so stuck that they're, you know, that the rock you're talking about that you can't get it, that has to be dissolved medically. They need to see their GP. But the sitting on the toilet, like sitting down, time sitting, and giving them the time to actually go, is that routine, that habit after they've eaten, so they have that kind of urge to go, is really important. One of the pitfalls of that is I find that kids go in and they bring on an iPad. And sure, they may as well be sitting on a couch with their pants down. Like they're not, you know, in the space that they're...
usually focused on the job.
Yeah, task at hand, yeah. Not, you know...
Fair enough, yeah.
Scrolling. Because they might have spent 3 months of, we did that. I have to knock on the door to get him out because he's on his phone. You're like...
Okay, fair enough,
yeah. So...
We've just talked about, you mentioned there, iPad use, device use and that. Are you seeing loads and too much of that? You know, and it's not about casting stones and telling parents that you're a bad parent because you're giving your child an iPad at all. Because I tried to really limit my children's screen time. And I was able to up to a point. And certainly even the TV has kind of fallen away now. They're not even interested in the TV. It's more YouTube shorts and TikTok and all the rest. And once they have a device... Jesus, no matter how many times you hide it, they find it, you know. But what are your thoughts on screen time and all of that? Should it be limited? What should it be limited to? What should we be aspiring to for our...
There are American Academy of Paediatrics guidelines in terms of how much screen time you should have. But I think that's all well and good. But it's what they're not doing with time. So there's only a certain amount of hours in the day. And if they're all filled up with screen time, they're not doing anything else. I think that's the problem with screen time. It's fine if you have a garden to say, go on out there, or if they have a safe place to play. But if you're talking about a single mother trying to get the dinner, he lives up in a top of an apartment block. She's not like, go on out there and go on out and play. She needs them to go away so she can get something done. And that's often, I think that's where we've got into that. And I think the problem is that kids don't play anymore, as opposed to, like, kids don't play safely on the road.
And do you think the kids don't play safely on the road because of the whole stranger danger thing? Or do you think it's because of iPads and all that? Or do you think it's a mixture of everything? Like helicopter parenting where parents feel that they need to stand and watch their kids play almost in case anything happens. There's that kind of worry a lot. Whereas when we were kids, I know we'd be gone from
for them, just gone the day. Yeah. And I think that's what's different between kids now and then. And it's kind of hard to turn around and blame the kids and blame the parents because they're, you know, they're not exercising, they've put on weight, they're on an iPad. And to bang on about the constipation again, they're not moving. Why were we allowed to play on the road? Why were we allowed off out in the street and play? Was there less traffic? Were the cars are the cars the danger? Because I don't know that there's any more strangers or bad people out there. I think there's the equivalent amount that there was, say, in the 70s and 80s and 90s. Just we're more freaked out. So it's our anxiety about, I don't know, whether it's what someone might think of someone letting their kid play in the road for a long time. I think that's part of it.
Yeah, do you know what? I think it could be, because I remember when my kids were that bit smaller, I would let them out, and I was pretty relaxed about it. But I did sometimes think, Jesus, people must think that I'm really chilled or too chilled, because they were probably sometimes the only ones out in the street. Do you know that kind of way?
Yeah.
But then also I think that because of both parents are working nowadays as
there
well.
There isn't many kids on the street. Yeah.
You know, kids are in creches for longer, or in childminders maybe, and there isn't as many children out in the street because they're other places.
Yeah, they're in
minded.
supervised care. Yeah. I don't know. Like, so my kids there's a lane behind our house, they can all play. They're locked. So I feel like that's a lotto for us, because they're off you go, going out. So I have an alternative.
Yeah.
But yeah, no, I think the screen time there's a whole load of studies. It's linked to less sleep, less concentration, less, but like poor performance in school. They actually did MRIs, functional MRIs on kids. I don't know how they got them into the MRI scanners. And they show them, they read books to them. They did books with pictures, and they did, a full on, like, cartoons images. Yeah. And how the brain was all connected, and the speech and language side just shut down.
With the cartoons?
Yeah.
Oh, yeah.
I call it, is it electrical or like digital sedation. You can actually almost leave your child there and they won't move if they have an iPad in front of them.
But we do it ourselves as well. Like when you're on your phone and you're constant, you're looking at it, you don't even hear sometimes what people are saying to you. So it's the same with them, obviously.
And it's funny you say that, because I say with the kids with concussion that if you're going to go and bar them, because when you're concussed, your eyes, they find it really hard to track. The movement that you have to read and to follow something on screen kind of makes them feel sick and can make them very tired. So I'd say, listen, no screens till they're a bit better. And I'd say, don't take, and particularly at night time, I'd say take the phone off them, go to bed, because they can't sleep because they have concussion and their sleep's all over the place. And of course, at 2 or 3 in the morning, they're just going to be like, So I'm like, take it off them, but you have to take it off you as well. Because it's not a punishment. Like, you can't inflict something like that without the adults coming on board as well in solidarity, because we love it. So we can't give out about kids scrolling if we're doing it as well.
Yeah. I don't know whether to talk now about, because there's loads of questions in about concussion, because you brought it up, or about the weight that you mentioned there. So what do you want to go with first?
I suppose briefly on the weight, there is a new service. They are building a service within Ireland for paediatrics, for severely overweight children. And you'll know there's the medical treatment of obesity that's rolling out now. That's kind of what that clinic's for. We've always looked after children with obesity in terms of screening them for diabetes and hypertension and fatty liver, that we monitor them. But we've had very poor success. Like, it's amazing that...
In treating them?
Oh, yeah, like when we look at your DNA, if you don't attend or don't come to an appointment, the highest non-attenders are the obesity.
Do we know the reason why?
Probably, I suppose, one of the root causes is motivation. You need a huge amount of motivation to treat obesity. And there's a lot. And maybe, I suppose, as well, coming back to when you know that you haven't done your homework, you prefer not to come back to the clinic.
And kind of what age range are we seeing? What would be the youngest that would be
So children are obese from 1 or 2. There's damage done at that age, but they probably won't get referred to us at that point. Like, it's really hard to become a non-obese child if you're obese in toddlerhood. Okay. So it's really hard to shift to become a non-obese adult if you're a non-obese child.
I never thought that a toddler could be obese. I just thought like a chunky, chubby kitty, and then...
I find a lot of the chunky toddlers they drink a huge amount of milk plus food.
Okay.
Because there's enough calories in milk for an infant. But when you don't need calories, liquid calories and food calories as well, Yeah. And then there'll be some cultures where it's just a lack of kind of understanding. There's like an African child that was really overweight that was drinking, they have these really marketed foods that are like sugary milk drinks.
Like the chocolate.
The ones with the formula type ones. They were really marketed in Africa. If they don't eat vegetables, it's like a vitamin, but it's full of calories. So they're having that and food, just in case they weren't getting enough nutrition. So they're huge.
But is that the same with the follow-on milks as well? Because I know with follow-on milks,
really
absolutely, they do not need follow-on milks.
Never drink them.
They just need to be bottle fed or breastfed up until
whenever you want.
Whatever you want. And then you put them onto cow's milk, isn't it?
Not bottle fed to whenever you want, but breastfed to whenever you want.
Yeah.
But then put onto cow's milk. But you don't need a huge amount of cow's milk.
No.
And you no more than 600 mils of cow's milk.
But you know the whole thing about the follow-on milk, that was those milk companies a way of being allowed to market baby milk to the public.
Because
you're not allowed
Yeah.
You're not allowed to market it or use discounts and things like that on food
under 6 months,
on milk that's suitable for babies under 6 months or something along those lines. So they got around it by doing those follow-on milks and trying to encourage people.
Yeah, you don't need to. Yeah, you only need to have one breast milk substitute formula if you're substituting breast milk for milk, and then you move to cow's milk.
Yeah,
but not loads of it because those kids always end up iron deficient.
Yes, okay.
Big milk drinkers. You know those ones who just love to. They got caught into a cycle of the baby not eating much food, or not being interested in food, and then worrying that they hadn't have enough food, so they've given them a bottle. So they end up on these massive bottles of cow's milk, and they come in with a really low hemoglobin.
Okay. So that's important as well. Yeah. And then I see that they have, in the past couple of months, the FDA over in America have approved the obesity, those like the Wegovy type injections. So we're talking about Saxenda, all of those kind of drugs for children 12 plus. So they've already been approved. And I think the European Medical Agency is going to go that way too. So that then obviously will feed into those obesity clinics that you're talking about with those children.
So some of those children with obesity will develop diabetes anyway and will need the drugs for diabetes. Mm-hmm. And then in terms of what's currently there. Mm-hmm. But if you can manage the weight, you can manage some of the complications. Like if you see the way things are going with obesity in Ireland, you're going to need a lot of new respiratory medicine as well. You're going to need children who are on CPAP masks. Like there's obstructive sleep apnea, heart complications. There's the demand, like those children with obesity will need an endocrinologist for their diabetes. They'll need the respiratory doctors for their sleep apnea. They slipped their hips. They have all these medical complications it's going to be a big drain on the, not a drain, that's the wrong word, but a huge use of medical resources. Yeah. And if there is a medication that's going to help offset that, it's a bit of a no-brainer that it's going to be used younger and younger. Mm-hmm. But the question is, why are children obese?
Yeah,
and the kind of food that children eat, people kind of scratch their head. I can't believe people give their children that, shitty food. And then say, well, if their children refuse all the other food and they're stuck, and then they end up throwing that other food in the bin, that's a huge waste of money. And people don't have huge resources. So like, try this and try that, because everything costs money. So they end up going with the cheap food that they know the child would eat, that's within their budget. Yeah,
and it kind of feeds into itself, doesn't it? But there was a couple of questions from mum saying, my 11-year-old is overweight. Now, they didn't say whether they're obese or not, I'm not sure. But how do we, I don't know, as a society, help these parents that they're looking at their child is overweight, probably not yet obese? How do we prevent the obesity happening in the first place, do you think?
You look at the shop that happens in that house and make sure that, I don't understand how someone will tell me they go for the biscuits and you're like, why are the biscuits there? If you're trying to help your child, don't put temptations or snacks and shop smaller. Don't have those things in your press. And the main thing I think is don't have sugar. You'll see if people cut out sugar, they don't gain weight or they lose weight. The kids have so much sugar in their diet. I think we can start with, the way one small change. That one small change.
The way you're saying, there's the fussy kids say that we'll just eat, say, digestive biscuits. So the parents are giving them to them because they're worried they won't eat or they won't. So is it a case of you could just say, well, look, we know if we actually starve them, they'll be hungry enough at some stage to eat that apple or eat that sandwich. No, I don't mean starve.
Yeah, but it's probably not,
like if we just take the stuff.
It's a gradual process. Okay. There's no way you could go.
We'll just don't eat for the day.
Yeah, and that child may be very rigid. There's a lot of children that are overweight that are really malnourished as well. They have like nutrient deficiencies because they are overweight from eating. The work could have started when they were younger, but there's a lot of work in trying to get someone when they're older to accept non-beige food.
Yeah.
You know, it's
And that beige
tricky.
food thing is actually a thing, isn't it? Where they'll only eat.
Yeah. It's very tricky. And I guess he'll go into that a little bit more in terms of what, like I think there's a lot lately about RFID, and I think people understand it a bit more, that it's not just...
Can you explain what that is to people?
It's avoidant restrictive food intake disorder. You know, like your extreme picky eaters that I think other mums will judge mums saying, well, you know, or other, sometimes there's people who...
What? Women judging other women? Are you serious? And mothers judging other mothers and their parents?
You know,
I never heard of that.
Congratulating yourself on the fact that your child, my child eats, you know, this. And you're like, well, and I think it's just a bit like the constipation. If you look back, there's a parent who has a very wide and varied palate. And so they're okay with textures and flavours and different, you know, whereas you'll find with the restricted food people, they often have a parent who's also a bit restrictive in terms of their eating. Okay. You know.
And is this then like a genetic thing then, or is it something that it's monkey see, monkey do? Or a bit of both?
A bit of both, I imagine. Yeah. I don't know. That's a lovely question. I do wonder, because it's not the only way to do that is to do a swap of the food, because it's the food that's in your house, the smells that are in your house, the food that you've eaten in the womb, they're normal to you. So if there isn't the smell and textures and tastes and different kinds of foods being offered to you and being on your mum's plate to eat, then you're probably not going to be that experimental either.
Yeah. There's loads to it, isn't there?
I find a lot of peds a bit psychology-ish. There's a lot of, you know, in the general peds stuff, the clinic kind of stuff, rather than the day-to-day work-based stuff.
Concussion.
Yeah.
Your PhD. Let's move swiftly onwards.
That was my PhD. I looked at like the response in your blood to a bang in your head, such like your immune response to a physical injury. There are changes in the children's blood after they have a head injury. And
so why is that? Please explain what an immune response to an injury means. Does it mean your white blood cells are going and trying to find this injury and sort it out, or what is it?
We've always looked at the white cells. There's lots of other chemicals in there that are sending messages to different parts of your body, and they're released by different parts of your inflammatory system. So you actually do see the white cells do jump with severe brain injury. They will, and with a seizure, your white cells will go up. But what I looked at was the chemicals that your white cells in your immune system released and what they looked like after you had a head injury. And just a mild head injury as well, like a concussion. And I can compare them to the ICU, really bad, fed out of a few stories, windows kind of blood as well. And then I looked at normal children. And then I looked at what their blood looked like if you challenged it with LPS, which is part of your kind of bacterial toxin, like 2 weeks later. And so there was still, like, your immune response to that stimulus was still different 2 weeks later after having a head injury. So there's lots we don't know, basically. A lot we don't know. And I looked at melatonin, and it's when you put melatonin into the blood, what that did to your immune response. And
do you mean by the melatonin that you'd naturally release, or melatonin that you take?
It was in lab-based, so it was in vitro. People have looked at what melatonin does after a concussion. A group in the States have looked at that, because people often end up on melatonin after a severe brain injury, but also concussion.
And is that because they have issues with sleep?
Yeah, because it knocks. So I looked at circadian rhythm as well after concussion. So I looked at the proteins that you, as part of your circadian rhythm, the proteins, so your BML, clock, Y, these regulators of circadian rhythm, and that's off. If you're in ICU, if you're really sick, your circadian rhythm's lost, like your day-night's gone. Yeah. But even after concussion, your rhythm's off. And they thought that melatonin should fix the rhythm, but might also have an anti-inflammatory effect. There is probably an anti-inflammatory effect with melatonin. Okay. Like, it is an anti-inflammatory medication. So it is, I suppose the bottom line is, it's probably a good thing after a head injury. Yeah.
It's a pity it's unlicensed here in Ireland and difficult to find and get. And like, in the pharmacy, we would have had children that needed melatonin for sleeping issues. And Christ almighty, the
paperwork of it.
The hoops you have to jump through because
The
if someone
hardship
has
fund thing.
the hardship bloody screen,
Like,
which is a
can you please
bloody
supply this
awful
in the hardship
name.
fund?
It's an awful name
Because
for something
yeah.
because
Like,
it makes people feel, oh my goodness, I'm a hardship case.
Yeah,
like it's bloody awful in the first
like,
instance,
I'll
right?
just, I'll just pay for it
I'll
myself.
just pay for it. And it's like, no, I'm not charging you €60 for this feckin' medication.
And it's over the counter. It's licensed on in a different way. Say in the States, melatonin's over the counter. It's kind of seen as a multivitamin or something.
It's seen as a supplement, so people take it to help them with sleep. But you can get it. It's amazing over in the States. You can buy it in in the drugstores. You can buy it for $10, but like
in
a
different
huge
formulations.
amount, but in like 10 milligram strength. Like, you're not even talking about the lower strengths
ones,
here.
yeah.
And it's just, I just think it's a real bugbear of mine. So someone on the medical card needs to go through the hardship scheme, and it's just and then others, people that aren't on the medical card, need to pay for it privately. So I don't know why it's so bloody difficult. And then
there's it doesn't taste very nice. The melatonin.
No, it doesn't.
Whereas they have them in gummy bears over in the States. So it's that's for your pharmacy friends.
I know I've given out enough about it, but yeah,
it
it's
works
just one of those
really,
things.
really well for sleeping children with autism.
Yeah.
There's a group of autistic children that do not sleep, and then they get melatonin and they sleep.
Yeah,
and I mean, it's a life changer.
It's life changer for the families as well, isn't it?
Oh yeah, I meant the families. I mean, I'm talking about entire families that have not slept. Like, sleep is, I think sleep is the new exercise. Like, it's.
Oh, I know.
It's the future, like, of health, and that's, part of that whole. My PhD, I looked at sleep with concussion and the anti-inflammatory. If you're in a pro-inflammatory state, you don't sleep. So if you're pro-inflammatory with your concussion. So I kind of I went down that rabbit hole of sleep for a while, kind of reading about it and interested in it. And then I ended up doing I did a coverage for locumed for a girl who was on maternity leave, who was neurodisability. And then I met all those children with ASD, with sleep issues. That's another thing that I think we're seeing a lot more of as well, is sleep issues in kids.
And is that in kids in general, or kids with ASD?
Well,
ASD being autism spectrum disorder, just for anyone.
Like children with autism have for a long time not slept. Forever have not slept. And children with intellectual disabilities.
And how do children with autism function when they don't sleep? So yourself, if you don't sleep, you feel awful and you're ratty and you're cranky. But I have heard from parents that their child just doesn't sleep. And it's like, oh, well, do they nap during the day? No. They literally could be up for 24 hours.
And then they might do, after a week, they might do a big sleep.
Yeah.
That's...
So how...
Hell. Maybe there's just not enough, I don't think there's enough medical concern about it, that we... Mm-hmm. I think we're thinking more about how we should probably fix it. There is a doctor I know who's very pro-sleep, who's trying to kind of roll out more of awareness around it.
Yeah.
If you don't sleep for 6 hours chronically, you are depressed.
Yeah.
Yeah, that's a lot of parents with the children with a disability who doesn't sleep. Or a lot of children. There's a lot of parents with children with a disability that they're just sleep with one eye open for the rest of their life.
With concussion, can I just ask you, obviously as a general ped in a hospital, you would probably see loads of concussions, kids coming in banging their heads, etc. Yeah. So with rugby, there's been talk in the newspapers about the fact that maybe they need to change the rules up for rugby, make it less impact, or change the rules so that, you've your young school-going boys that aren't actually getting head injuries or concussion after concussion. What are your thoughts on that, on rugby playing and
you're talking about rugby specifically?
Rugby specifically, because it's the one that...
Because it's the one that was the sport branded as having concussion.
Yes,
I feel.
So that's why I want to discuss it with you, because I know...
A lot of our younger kids actually get their concussions from the schoolyard.
Yes.
When I did my kind of study, it's because they're running around in an enclosed space on concrete, which isn't probably ideal. So I think it's a bit like the way we stop kids climbing trees. What have we taken away in stopping them climbing trees?
Kids need to climb trees.
They need to climb trees. They need to experience risk. They need to feel their heart racing.
I have to say, before we came into the podcast, I got a phone call from one of my kids who's locked out of the house because we all left him there. And he goes, "Oh, I'm just going to check and see, is there a window open upstairs, and I'll try and climb up." And Emer just goes, "Oh yeah."
And that's where you're like,
scared. No. She kind of looked a little bit scared.
I was like, well, that's innovative. That's, problem solving.
Exactly.
But you need to learn to problem solve. There's a lot of stuff that kids learn through play. Mm-hmm. And if they don't play, they don't get that. And with rugby, I suppose. I've no interest in.
Or affiliation with rugby. Okay, yeah.
Rugby or any sport. But like that, you get a huge amount from being on a team. You get a huge amount from running. your heart racing, exercise. Kids who do more exercise sleep better. So I think, well, actually one of the things with the kids that you stop playing their rugby because they have a concussion is they can't sleep because they've so too much energy. So the whole thing about having a head injury, if you have a concussion, you're out till you're better. If you have a second concussion and it's really bad, then you start thinking about things. But I think don't throw the baby out with the bathwater. Mm-hmm. There's a huge amount you get from the team sports. There's a huge amount you get from exercise. And once we've taken the kids out of the trees and we've taken them off the rugby pitches, you're only ending up with them on an iPad.
Yeah, yeah.
You've got another problem.
Yeah.
So there's some kids who would probably have to stop playing. There's the odd kid, but you want to find something else for them. And I'm always like, what about rowing?
Why rowing?
Because you just can't bang your head. Do you know, but it's really physical.
And are you really risk averse being a ped?
No, I'm not risk averse at all. In fact, you know my sister. And I think
just for anyone out there who doesn't know, Professor Katrina Ryan, Emer is her sister.
Yeah, so I think she
younger sister. She made me. She made sure that I'd say make sure I get it in that she's her younger sister.
But I think she thinks that I'm like feckless. I think my mum thinks I'm feckless. You know, like watch him. And I'm maybe a bit more laid back and a bit more chill about risk.
Yeah.
I know, my child was up a tree, and her mum came to tell me. She said, "Oh, he's up a tree," and I went, "Yeah, I guess he's probably okay now. He's old enough to be up that tree." So I think when I went down another rabbit hole when I was reading my PhD about risky play, it does set you up in terms of how you're able to take life risks.
Yeah.
So I think it's tied into that anxiety thing about kids are more anxious. Why are they more anxious? They're not being allowed to take risks. They don't have practice.
Yeah.
Within play.
It's like, oh my goodness, it's like all feeding into itself, isn't it? It's like the exercise, the diet,
bring back the 80s.
Risk taking.
Bring back the 80s with the ham sandwich and the bikes in the road. Yeah. And that's like, because you have to ask yourself, what is wrong with that now? What are we doing differently? Because we're doing something differently to the way kids were brought up before, and it's not better.
Yeah.
And I really think it boils down to the old to play.
Yeah.
Like and to not being supervised. That I don't fully supervise the children. But sorry, you're with rugby, yes. I just don't think that you can hate on it. Mm-hmm. Do my kids play? No.
But your kids are young.
If you have a 7-year-old boy, he plays soccer and he plays GAA, and I've got a real kind of grow off the GAA because I feel like they just mop everyone up and they bring the kid that doesn't do any sport always plays GAA when they come into clinic, and they're really dyspraxic and, you know, clumsy, and and they'll still play GAA.
There's
and
a
I think
place
that's lovely.
in GAA.
There's always a place for everyone. Yeah,
there really is. Now it's a little bit like the mafia too, I find, as in once you're in, you can't get out unless you die.
But there's that belonging thing that kids need.
There absolutely is, and do you know what? They've done such an amazing. I don't know, the way they build that sense of community within the GAA, that everyone is valuable, everyone is worthy, every kid can join, and there's a team for everyone. And then with the volunteers and everything, I don't know, it's an amazing organisation.
Yeah, no, my brothers play GAA. I played a little bit, but my brothers are very in that mafia.
Yeah.
Very much still.
I know. And we're even getting to the middle of the summer and we're still getting, you come and train and you're doing this and there's matches on still. So they're really into it. Like the volunteers that do it, they're really into it, and the kids are into it as a result then. My
younger brother used to go down to the country, to my uncle's farm, Sligo, for the summer, and he used to get the bus back up to play a match.
Jeez, okay.
Down. When he was about 11, so I suppose he was being put in the bus by himself. This kind of like we're talking about, what's different between now and the 80s and 90s? That
you would be put in a bus by yourself and allowed to go to Dublin.
You wouldn't be put on a bus, bus by yourself, I don't think, would you?
These
Maybe
days,
he was 13, like
not.
disclaimer, my mum doesn't listen to these things, so it's okay.
Probably not these days, no. And even actually I'd left shoes in town. That just sounds racier than it is. I was doing some event and I'd left my shoes in town that I changed, and I was going to send my 10-year-old in today on the Lewis to get them. But he was like, but I can't do that myself. I was like, well actually you can.
Probably can.
But actually it turns out that there was someone else in town that said they'd do it for me, but I was fully prepared to do that.
I guess the thing, all I can't understand is how you've got your child on a tracker. You know, in 2023.
You can actually track the amount of purchases they make with it. Wait until you get your one, the Revolut.
You can actually just, you're going to be watching them moving around. You can probably put a webcam on them, send them into town. Yes. But the 80s, 90s, you had to just go, they'll be okay.
But people didn't even need People didn't even think that, though.
That they wouldn't be okay.
They just thought, yeah, that's fine. But even nowadays, you can actually check, because if you have the Revolut set up, your kid can go on your Revolut, right, where you give them money and they pay with their Revolut card. You can track what they're buying. So if they
But you know that you can do Find My iPhone and follow your kid everywhere they go. You do know that, don't you? You do have to.
I do know that, but I just think that's a little bit intrusive.
Yes, thank you.
So, if I have a teenager now and I have another fella who's 12, another fella who's 10, the two older ones have phones, but I just think, Christ almighty, I had some sense of...
It's like tracking your husband. Just don't do it.
Yeah, I'd track my husband before I track my kids. But it's just like, God, I went out and, I got the dart out places and I,
you probably did stuff that I shouldn't have done.
And my parents knew no better. But you kind of almost have to do that.
You have to make mistakes, though.
Yeah.
I think maybe nobody makes mistakes anymore.
If they do, they get caught pretty quickly, don't they? So look, each their own.
Sorry, I meant to come here and talk to you about medicine stuff.
I know, and if you track your kids, that's fine. That's your choice. But I just think, oh God Almighty.
So what I wanted to do, one of the things I want to talk about that was new and was exciting is the chickenpox vaccine.
Okay, go on. Yes, talk to me about that, please.
And yeah, my kids, I gave them the MenB vaccine. I paid for it before it came out. And then the chickenpox vaccine, they've had it, and then when they're like the class WhatsApp goes out and it says, "Oh, someone has chickenpox." I'm like, I don't care.
Yeah.
Not that I don't care, but I'm pretty smug.
Yeah.
Because I'm like, this isn't going to affect me, But then I think that I was like, should I tell them about the vaccine? But then you don't want to be that person that says,
you
can get a vaccine for it because you don't want to open up that can of worms in your social capacity.
Yeah.
As a parent of a kid, you're.
Yeah.
So, but I did want to say, you can get a vaccine. Because people didn't know and people don't know. And it's now I think they know now because it's coming out.
So it's going to be part of the schedule. But
it's been recommended.
So it will.
It will be.
So, but that will only be for children up to a certain age now. It's not going to be rolled out for every child, sure it's not? Usually when they bring these out...
Yeah, but they'll have probably had it already.
Oh, yeah.
Chances are they've had it.
Okay, yeah.
But it's funny, we had a doctor over from Sydney working the last couple of years, but the last 2 years.
You're horrified that it wasn't on the schedule.
No, she'd never seen
She'd never seen chickenpox.
I have to say, I've never seen chickenpox before.
Goodness.
She's never seen it, like.
Okay.
And they don't see it in the States. And I've seen horrible cases. I'm not talking about horrible skin stuff. I'm talking about strokes, cerebralitis where they can't walk for weeks, or horrible holes, big pock holes in their skin, like that you could have put like an old £1 coin into from a strep infection. And then what we've had this last winter has been
Strep A
in the chickenpox. So the kind of what we wanted, it was like everyone get the vaccine. We wanted everyone to be getting the vaccine so that not because we worried so much about the chickenpox, but the
secondary infections.
Strep infections, yeah.
Actually, I want to talk to you about the Strep A that was last winter because there was...
Yeah, horrific.
Oh my God, it was awful. So with the chickenpox vaccine, can you just answer this question? If a child gets the chickenpox vaccine and then if it wears off, will the chickenpox that they get when they're older, if it wears off, or will they get a shingles infection that's really bad because their immune system, they haven't had it before as a kid? Does that worry that they'll just get it really badly when they're teenagers?
No, so the decision is now whether to do 1 or 2 doses. So if you do 2 doses, they're pretty much immune. Mm-hmm. And then they're not going to get it from anyone because nobody's going to have it.
Yeah. So it could be eradicated like TB.
Yeah, it won't be floating around. But then, what we might find out, we need a booster when we're 50. I think we can deal with that when we're 50.
I think so. But the shingles vaccine should be rolled out to everyone over a certain age.
Yeah, and there's also, there's a chickenpox, or not chickenpox, cold sore vaccine.
Do you know what?
Super expensive.
Yeah, I did, but I just don't talk about it because it's so expensive. And
but I think if you're someone who is riddled with cold sores,
and if you get that vaccine, you can actually prevent yourself from getting them again.
And then I don't know whether you're... myself and my sister used to do when we got a big bad cold sore when we were like teenagers, and teens, 20s, we wouldn't be going out for the weekend with big we'd go and visit our uncle in the weekend. We'd be like, you're here to see me. Oh, you've a big cold sore. But now we just take Valtrex.
Yeah.
That's a trick that nobody knows about either, that if you're like, I feel a tingle, take it.
That or fabÜ even you can take as well, one of those, yeah.
But I would have taken that in when I had one of the babies, I don't know which it was. I had a big cold sore. She's about 5 days old. So it's safe to take breastfeeding. and then you disappear your co-sore and you're like less freaked out about
giving it to your baby. Actually, on that, can we just talk about the kissing the babies when they're just out of the womb and, you know, whatever.
Or passing them around.
Oh, and passing them around to everyone. And there's this whole thing about, well, I think parents are a little bit more vocal about it now, but you know the way people come and they just want to hold your baby, and some of them want to actually kiss your baby. It's actually totally okay to say, listen, these guys aren't footballs and you're not allowed to
they're
actually kiss my
actually a
baby.
person. Imagine you were being handed around the room 20 people.
I know.
Like, oh yeah. Like being touched by 20 different people.
Like, my mum used to always say, can you imagine their little bones and their little muscles must be so sore being tossed around, because all they want is their mum or dad, really.
Yeah, they're like, what is this weird smell? What's this weird smell? But it's just, I don't think you don't feel like you should pass your baby around to anyone. Yeah, nobody deserves the go of your baby.
A go. Oh, that's it, isn't it?
Give me a go. I've go. No. That's the great thing I found breastfeeding, that you just stick them on your boob and nobody would try and get them off you.
Yeah, no one comes near you. It's great, isn't it?
It's real, yes. That's one way to do it. But yeah.
If a baby gets a co-sore virus, especially pre 5 days old, though, like if they're very young, it's very dangerous, isn't it?
Yeah,
but they go to hospital.
They come to us and they go on antivirals. So we admit them for antivirals.
So if a mummy has a cold sore, right, apart from just say she didn't know about this Valtrex or doesn't know about this Valtrex, or if a mummy has a cold sore, what should she do to protect her baby that's very young?
Ooh. So if the baby, if she's breastfeeding, breastfeed away, stick on one of those competes, take your Valtrex.
Yeah, go to the doctor and get a prescription for Valtrex.
But if they get a rash, they have to come in.
If the baby gets a rash.
Baby,
but you don't kiss your baby, you wash your hands. You know, between touching your baby and try not to touch your cold sore, etc. You have to be very careful.
Just cover the cold sore. The cold sore is gone. Then you don't need to worry about it so much. Don't be sticking your hands in their mouth. Yeah. But don't, sometimes people get so afraid of damaging their baby, they don't touch their baby.
Okay.
Like, you don't have to isolate from your baby, is what I'm saying. You know, that's important too. Like, it's like sometimes people try and isolate their siblings from a baby for like 3 months. And I'm like, it's just not possible.
But actually, during COVID, do you remember it was whole you isolate yourself from your family if you have? Do you remember at the very start? And I had people messaging me going, really, do I actually have to isolate myself from my children? And I was like, they're
probably already infected.
Yeah, exactly. But
the other thing, sorry, on that thing about bringing the baby into hospital if they've a go sore, one thing that maybe people don't know enough is that if their baby has a fever before they're 2 months old, just bring them into us in hospital.
I thought it was before they were 3 months old, actually.
Yeah, before 3, and then we've said before 2, 100%. Yeah. Before 3, unless bring them to see a doctor. But I think if you're under 2 months old, it's straight to jail.
And why is that? Can you explain why?
Because their immune system isn't well developed, and they're at risk of meningitis and sepsis and serious bacterial infections that they don't really declare. Like, they don't say, "Hey, I'm really sick."
Yeah, they just cry and you don't know what's wrong.
Yeah, it's hard to tell. But a fever is a fever.
So what is a fever? Tell me what a fever is.
It's over 38 degrees.
Celsius. What's that Fahrenheit?
Oh, I don't know. That's
okay. 100. We're so Irish, aren't we?
We used to do it. My mum used to do it I think it was over 100. Someone will know. But you know what the funny thing is? If they feel hot, then they're hot. There is 50. They did a whole study on if they felt hot and they were brought to hospital, did they have a fever? 50% of the kids that were brought in because they felt hot. Yeah, they're not warm, but hot. You know, if you're like, oh, am I?
I know. I had one of them. My third, actually, he felt hot. He was under 2 months. It was like query meningitis and everything. And I remember the way they're just always on top of you anyway. But anyway, he felt too hot for me, and he wasn't feeding too much. My boobs were nearly going to explode because he wasn't feeding
taking milk away.
I remember holding him to my husband and saying, "Does he feel warm to you?" And he held him. He goes, "Oh yeah, a bit," and then just passed him back to me. But I knew that he felt hotter than normal. Do you know what I mean? Because obviously he was like, another way when they're first born,
you're around them so much.
You're around them so much, you know. So we went into hospital. Anyway, it was just a UTI, but he needed lumbar.
Just a UTI.
He needed a lumbar puncture. I know, yeah, but he needed a lumbar puncture and everything.
Bacterial infection.
Very serious bacterial infection for a little small baby, because it could have got sepsis if it wasn't brought in sooner.
You can get meningitis from UTIs.
Yeah,
in small babies.
So the point of this conversation is, if your child feels feels hot, and you know there's something wrong. Generally, actually, my brother, who's a paediatrician, said you generally go on if the mummy says this baby's off. You go with the mum's instinct or the dad's instinct. Sorry, not to say that dads don't know too much, but do you go?
Don't. Tends to be the mums. No, but you know, with it. So I don't have a thermometer. I think I do somewhere, but I think I have a thermometer at home because if they feel hot, they're hot.
Yeah.
It kind of, well, in an older kid, it doesn't really matter what the number is.
Okay.
Right? If they're hot, they have a temperature. Maybe we should talk about why they have a temperature. We might talk about fevers a little bit. But if they're small, you know those ones that go into their ears? Their ears are this size.
Yeah.
That's this size. It doesn't actually get in to get their core temperature. So it doesn't actually read. They're not
those ear thermometers
reliable.
aren't reliable. They're also very expensive. And I know a number of peds like yourself that say, Jesus Christ, the amount of people that come in with either too hot, the ear.
It was 36 in one ear and 39 in the other. And you're like, well...
It's one or the other, and that's not reading it right.
Yeah.
So what kind of thermometer should people use on a baby? And how should they take it?
The little old-fashioned one under their arm.
What about rectally? I used to do it rectally, but
we're
I
not
didn't.
supposed to be sticking things up babies' bums,
Okay.
I suppose. Yeah, no, I mean, they I'm just thinking about your dirty thermometer in your medicine cupboard with a big lump of poo on it.
Oh yeah, well I cleaned it afterwards. But there was one point where I had two, and I was like, which one was the one that I used for the rectum? Anyway, I'd been.
But no, that's a core temperature. So there's core. If you're talking about which is what's temperature, you're allowed a little bit higher peripherally than you would be core. So the under the tongue.
Yeah,
your mum used to do that. When so that's you can't do that in a baby with the thing. So under the arm is fine.
Okay.
I took 5 strips in the hospital, so I always had the little thermodot strips. Because I only ever needed to know if my child had a temperature under 2 months or 3 months.
Yeah.
I don't really need to know if they do.
Okay.
After that, if I don't know whether that makes any sense.
And why do you not need to know?
People are obsessed with numbers. They're like, it was 30, 39, or it was 30. There's no problem.
But if it's like over 40, is it not worse than it being under 40?
Some people just get really high temperatures.
Okay.
But it's more how sick they are. Do they look really sick? Or do they, very simply, they feel hot?
Yeah.
Do they seem sick?
Are they irritable? Are they off their food?
So we'll put the small babies to bed for a minute. The older 3 months onwards, if they have a temperature, you want to kind of know, I don't worry that they have a fever if they have a viral infection. If they have an immune system, so they're going to have a fever. I'm maybe looking for a bacterial infection. So do they have a UTI? Do they have a strep throat? Do they have a pneumonia? That's the question, not what the number is.
How does a parent know whether it's a viral or a bacterial? That's the thing.
When they have a temperature and then you give them a bit of Calpol and Nurofen and they go back and they play in the corner in the ground again.
Yeah.
And then, but 6 hours later it wears off and they have a temperature again, they feel it, and then they get up and they're playing and dancing again.
Yeah.
I wouldn't be too worried about that. Like, whereas a child that's sleeping a lot, tired, not eating, listless. They used to say lobbing and lying in the flats. They were just lobbing and lying.
Okay.
Was the word. But they're not well. And it's okay to be wrong. It's okay to come to the hospital or to the GP and be wrong and then be okay.
Yeah.
But I wouldn't be too worried about a kid who's back to themselves after you've given them a bit of Calpol.
And what are your thoughts on, because there is people out there that think a fever is there for a reason. It's your immune system trying to fight this virus or bacterial infection that your child has. So by giving it Calpol or Nurofen, you're blunting their immune system, and you're reducing, because the whole nature of getting a fever is that your body heats up to kill the infection. That's a way that it works, one of the ways. So by giving them an antipyretic, which is something that reduces their temperature, their fever, you're blunting that response. What are your thoughts on that?
It's true. Yeah, you'd be fine not treating it, but it's about comfort.
Yeah,
it's really, if they're going to be more comfortable, like I'd say, go ahead and give them something to bring their temperature down.
And will they have less of a chance of getting a febrile convulsion, giving them the Calpol and the Nurofen?
The thing is, apparently, if you're going to have a febrile convulsion, you're going to have one anyway, without the antipyretics. And the thing is that you get a febrile convulsion as your temperature goes up. So, sorry, but febrile convulsions are really, what they are. Some people, they're like 1 in 20 kids will have a...
And just explain what they are.
It's a seizure that they have at the time of fever. If they have, and it's usually a short convulsion. They wouldn't be any longer than 15 minutes, like 5 minutes usually. And often they're just a minute. They feel like a lifetime.
But they're very scary for parents
really
to watch.
Scared. Oh, really scary. Your child has a seizure.
Yeah.
And then you're told if your child has a temperature again, they might have another one.
Yeah.
See you later. You might get 8 fevers a year, bye.
Yeah.
It's quite scary. So giving Calpol and Nurofen doesn't usually affect the fact that you're going to have one, because the sudden change in temperature from cold to high, that's apparently when you seize the change in temperature that your body has. And so usually it's at the beginning. So you're like a bit of a snotty nose. You don't even know that your kid's about to have a temperature.
Okay.
And then they have the seizure.
Yeah.
And then they have the temperature and the ambulance on the way.
Yeah.
You know, that's how they show up. So,
But if your child does a febrile convulsion and it does subside, should you still go into the hospital to make sure everything's okay? Or
so your brother works in Australia. Australians are like,
Yeah.
everything's fine. They say if they have a seizure and it's over,
don't bother, you're home. Yeah.
you don't need to call an ambulance. But I think that's very hard to say to anyone. Come on in and be checked out, and let's make sure that it isn't. Let's see if we can find out where the fever is coming from. It can be very hard for the doctor to tell you why your child has a fever, because it's the very beginning of an illness. They don't have pus in their tonsils yet. They might have pus in their tonsils the next day, where they don't have a red ear. It's the very beginning of them being sick.
Okay.
But it is good to have them checked over to see if they have a treatable cause of.
And those convulsions can make parents worry that they might get brain damage as a result of the convulsions from all the shaking, or that there's something wrong with them. Can you reassure them in any way?
So they're really common, febrile convulsions. And the shaking, is short and they usually stop. So you're not supposed to get brain damage from seizures that are less than 30 minutes.
Okay.
You just need to make sure that the thing is that you don't want to have a febrile convulsion in the middle of dinner. That's the other one of those kind of tricky things.
Yeah.
But that
because there's a risk of choking.
Yeah. So but that they're put on their side and that their tongue drops forward. That you put them roll them onto their side, because that opens up their airway. Because if they're lying back like that, it won't be as easy to breathe. But so just roll them over onto their side and time it. That's hard to do if you've ever been asked to go.
Stand and watch your child convulse.
But just if you have an idea of the time that usually what happens is you check your phone at the time that you made the first phone call, and that usually tells you when it started. So that'll give us an idea usually of how long it lasted.
Okay.
But there's often a family history.
Okay.
And if they're not getting them super young, they're about 25% of them get a second one.
Okay.
Which isn't a lot. Yeah.
Next question. My son is 14 and has a very small penis, and his penis hasn't grown at all. What should I do? He has expressed concern himself.
Puberty is another one of those things that we assess in clinics. It's funny, in America they have a well child check every year, so they're being looked at every year. But here,
do they?
Yeah,
Actually, that was another question, but I'm cutting across you now. But someone said, "Why are paediatricians in such short supply here? Everyone has a paediatrician in the States." Oh, I just went to my paediatrician. Whereas here, you don't see a paediatrician unless you're sick.
GPs.
Okay,
we have really good GPs, and it's the billing, that billing sort of stuff, and that. I don't like when I was presenting. I'll talk about the penis thing in a second, but people get CTs in America that they don't need.
Yeah.
Because it's billable or because their insurance covers it. That's a normal thing to worry about. And sometimes they worry about the size of the penis in a small baby to start out with. So a baby's born and often the dad's worried and they'll come into the surgeons and say, well, this penis looks very small. Is it okay? And actually a lot of it is that they've this fat pad. So they've like this fat at the front of the penis.
Oh, yeah.
And if you pull back the fat, you can see that it's actually a normal size.
Okay.
And so there is central charts to check that the penis is the right size, because you could be low in testosterone. And that's why, there's medical causes of low testosterone. So that might be why the penis hasn't grown as a small baby. So it's a valid thing to get checked up. And then as a teenager, you should start puberty. So you come and have a pubertal assessment and we'd look and see if there's underarm hair and if there's pubic hair and whether or not the testicles have enlarged. So the testicles and penis should enlarge at a rate. And there's central charts to look at that. And I would...
Boys can start puberty a lot later than girls, can't they? And roughly what age is it to expect the boys to start changing?
Yeah, 14 would be an age to look at, yeah.
Because their penises can go from literally overnight being just like normal little boy penises to actually grown man penises.
And if that happens too soon, like if you're looking at an 8 or a 9-year-old, that needs to be investigated.
Yeah.
So she's right. Like that mom's right. Yeah. But so she should bring that boy along to go to the GP and be referred into a paediatrician.
And then another one actually asked about her 2-year-old's balls have not dropped yet. What should I do?
They should be down. They like them to be down. So if they're not down by 6 months, I feel like they're not going to be down by a year. They like to operate on them before a year to bring them down. And the reason that they like to bring them down is that they don't get too warm up there, because it can affect their fertility, and that
even though if they're babies, can they not just do the operation later on?
No, they need to do it sooner.
Okay.
And then they want to have the testes down there so that because they're at a higher risk of testicular cancer. And they need to be able to feel it. So I remember hearing about a horrible case of a child who was 16 who only had one testes and the other one was inside his abdomen, and then he had a testicular cancer nobody saw because it was there. Anyway, that's an aside.
But they're not more prone to testicular cancer because their balls haven't dropped. Is it more that
they are at higher risk. Yeah,
Oh.
that should be seen, and actually it's one of the things public health nurse looks for as well. And the other thing is make sure that they actually aren't down, because sometimes they're just hiding. Because if you touch them, they jump up again. There's a cremasteric reflex. There's a knack to checking that they're down.
And if you check the testicles themselves, or
if you don't touch them straight off, they can
disappear.
That person should go and see their GP and have someone.
But even if you run, were you saying if you run it up their leg, if you run your finger up their leg as well?
It jumps. It's a useful test for testicular torsion, because if it's torted, it doesn't jump. It's all twisted on itself. And actually, that's another, because
I want
Irish
to talk
people
about
are
testicular torsion, please.
Irish women or Irish people are so strange about it. For a boy not to tell his mum that his testes is sore for 2 or 3 days and to lose his testicle is a shame.
No, it is. Can you please explain what testicular torsion is and the amount of time that people have to actually save the testicles?
8 hours max.
Oh yeah, okay.
So if you walk into A&E with a testicle that's sore, you'll be triaged as see that one first.
Yeah.
After the resources.
Yeah.
But that's considered really important. Mm-hmm. And so any boy complaining of tummy pain always need to look at their testicles, because it's referred pain sometimes. It's the testes is on a little string.
Yeah.
With the blood supply going down to it. And if it twists around on itself, it cuts the blood supply off and dies. And they have a short amount of time to just open it up and untwist it and then tack it down.
And why would it happen? Why would it twist? Is it play? Is it, again, no climbing trees? No climbing trees.
I'm sure there's a reason, but it just
happened.
happens.
My cousin and my brother, the fellow who's in Australia, they were playing. Yeah. Oh, he's old now, so I'm sure he doesn't care. Yeah. They were playing as kids. They were about 10 or 11, and they were on a high wall. I think my brother pushed my cousin off the wall and he fell, and he got his testicles twisted as a result, and he ended up in hospital having to get them untwisted. Like, he was in an awful lot of pain. If they don't know if they're twisted or not, they'll put you on their anaesthetic and look. Yeah. Not you, a boy. Yeah. But can they do an ultrasound on it? They can ultrasound. It's so important. Yes. Either they will on the ultrasound they've the flow, you see. They've the blood flow. But they won't go and wait for an ultrasound if they're like, these testicles need to be looked after. So if a little boy has testicular pain, or you were saying tummy pain, that's going to frighten people now, because if a kid is tummy pain, not every tummy pain. Little boys can have tummy pain. But don't be afraid. If you have boys, you're going to have to ask them, is their testicle sore? Yeah. Maybe have a look at it. You know? But you can't tell by looking at it. Sure, you can't. But sometimes they can get very swollen. They can be sore and swollen, yeah. But sore, and if you run. If you run your leg, don't run your finger. Like you will see that it doesn't jump because it's twisted. Oh gosh, yeah. It actually sounds so sore. The other thing that would come into A&E, they would have seen a lot of is crying babies and overfed. This feed the baby, keep feeding that baby. And I think this is why I ended up becoming a lactation consultant, is because everyone kept telling me to feed my crying baby. A bit hungry. The child was like a pate duck. He was full of milk. 0.5 kilo a week he gained, because it was just feed that baby. And were you exhausted though, feeding? I was really thirsty. Yeah, so you were. I used to drink about 3 or 4 litres in the middle of the night. Yeah. I don't know how it didn't click sooner. You can be as sensible in normal life, but after having a baby, no sense whatsoever. And then I went, oh my God, I can't believe this. He's so overfilled. He's choking on his milk. He had one of those reflux seizures. There's this thing called a Sandifer seizures where they reflux and they kind of seize because they drowning on their milk. And that was you can never overfeed a breastfed baby. So that really annoys me when people say that, because you can. You can. But he was just tired. He was just tired. Okay. And some babies just cry, not because they're hungry, but because they're tired. And because they can't put themselves to sleep. Not very good at putting themselves to sleep. And maybe this is why I'm a bit more obsessed with sleep, I think, than I should be. But it's still not great at sleeping. Just some babies are born with skills. Some kids are born with skills. Some people are not very good at going to sleep. And some babies are crying because they're overtired. So a small baby. And what do you do with a baby that's overtired then? Anything you possibly can do to get them sleep, but try and get them asleep before they're tired. So that's a trick. Okay. Trying to get an overtired baby to sleep is impossible. So
like an hour and a half. One yawn, they're out. One yawn and you are out there with the buggy. You are walking. You've got your white noise, you got your buggy, you got your rocking, your shushing, your patting.
Yeah.
Whatever you have to do. And it's either if you need it or feed, whatever you need to do. But don't feed and then they wake up because they're windy. That off, they'll sleep for like 10 minutes and then they...
Yeah.
But they have... Your brother's in Melbourne, you're saying? Is he in Melbourne?
He's in Melbourne, yeah.
They have these peri-partum kind of homes for mothers who are struggling. They'll be admitted. So mental health stuff, but also awful sleepers, awful feeders.
Minded then as well.
Yeah.
It's lovely, isn't it?
It's lovely.
I would have checked myself in there when I first born,
actually. All the time. We would have seen, and as a consultant that I would have trained with, and he's now our clinical director, but he always took crying babies really seriously in A&E. And he used to give them a review appointment because like a crying baby is liable to be shaken. And I don't know if parents... Or I don't think people believe, I believe it because you see it, but that anybody could shake their baby when it cries too much. And when people...
As in shake it out of frustration?
Shake it out of frustration and cause brain damage and cause just damage their whole entire life. And that a crying baby on the floor is safe. If you can't get the child to stop crying, just leave, walk away. Walk out the front door.
Okay.
Even for 10 minutes, walk out the front door, the baby's fine.
Yeah.
And we talk about... not supervising your children. That is an absolutely fine thing to do because it is so frustrating. That does happen, and it happens more than you would believe it happens.
And these are specifically newborn crying babies.
Yeah, usually they ramp up at around 2 weeks.
Goodness, do you know what I did with Art? Like we were so green. When I had my first fella, and my mum and dad were horrified. When he was 3 weeks, we decided we'd go to Portugal for a week. I was like, it's grand, I've got my booze, I can take him, a few nappies. Forgot to pack my own clothes, packed all his clothes, went over with a t-shirt and shorts, And he developed the crying baby or colic over there. Sweet mother of Jesus. I remember my husband at one stage, 11 o'clock in the morning, buying me a pina colada because I hadn't slept all night. And he's like, just have this, go for a little doze in the sun and I'll take your man. This thing, this monster that's taken over our lives.
Didn't know how to sleep.
That just did not know how to sleep and didn't and we thought it was colic. I don't know, but I remember bringing him to a restaurant when he had his first outburst. So we didn't know. We were like, this is brilliant. We just, we thought it's great. Like you say, for the first 2 weeks, we thought, my goodness, we're really good parents and this is a really good baby. We took him to every restaurant we could. And then we went away to Portugal. On the first or second night, we took him out to a restaurant.
He didn't get bronchiolitis.
And he literally screamed the entire restaurant down. We never got a meal together on that little holiday that was supposed to be our lovely little baby moon. Well, I tell you, never again. Why did you say you were surprised and getting bronchiolitis?
To every restaurant possible. Sneezing on him. But those babies, I have a friend whose baby cried more than my baby, and she was leaving the house with the baby crying one day. And I said, "Is she okay?" Oh, that's just her life now. But, that baby cried for about 7 months.
Yeah.
Yeah, I think we don't... Some of those babies that just need a bit of TLC, we don't have the facility. Like Dublin doesn't have the capacity to admit them and to help them. Mm-hmm. But that consultant, Ike, used to bring them back to a review clinic to make sure that they were safety netted, because a lot of children who are shaken have visited A&E in the previous week.
Okay.
And
can you tell if a baby's been shaken without doing an MRI or any of those things?
They might see cerebral apneic or,
And then, because for the parents, obviously, they feel bad. It's awful what's happened. Everyone feels awful. But how are the parents minded and looked after? Is the baby, are they considered social workers care? Is the child taken off them? What happens?
It's tricky because it's an assault, so there's legal and social ramifications to it. I think the best way to fix a situation is just try and prevent them happening. I don't know whether we're set up well enough in this country to prevent, if that people are struggling, that we don't try and cushion that a little bit, or that we know that someone has had an awful childhood and that history will repeat itself, and we don't try and help them parent differently. To put in the supports to coach them to parent a different way. Because how would you know what to do except all you know?
Yeah. Do you also think, though, as well, that in today's society, it's very nuclear family, and a lot of people might be on maternity leave and their friends aren't on maternity leave at the same time, and they live maybe in an estate where their neighbours are all working, there's no one around, so they're literally by themselves. Whereas years ago, I remember in our house, like, there'd always be the neighbours calling in for cups of tea. We'd be eating our dinner and the neighbour would come in and just pull up, sit beside us and chat away, and babies would be... My mum might go to the shops and we'd be thrown in next door to the neighbours.
Yeah,
and,
can you hold
likewise,
on from us? Yeah. We have a little bit of that going on in ours.
Well, that's lovely, but it isn't really done. Or you almost feel like you have to pay someone to mind your child if you need to nip out to the shops. Like I remember I would have had one of my kids in the nursery up the road, but the baby would have been sleeping and it would have been nap time at the time that I had to collect the kid from the nursery. So I was like, can I leave him in the house by himself for 10 minutes and go to the nursery and come back while he still sleeps, or do I have to lift him from his nap? Because I'd no one to call upon to just mind him for the 10 minutes.
What's the correct legal answer?
I know the correct legal answer. I'm not going to tell anyone what I did.
No, because remember someone else telling me that her mum used to collect the kids from school while she had her nap in the olden days. There isn't that family support with the family and the neighbours. But you know, particularly, I remember like when I started peds and I was in Temple Street 2008, remember there was a big crash?
Yeah.
And there was a lot of immigrant families that might have been in construction. And there was dads left at home with children as well that wouldn't have been used to it.
Yeah.
And because it was still cleaning jobs. And so there was a little bit more of spike of kind of...
Okay.
Taking maybe sense of... If you think it's bad for you, it's so bad for someone who's an immigrant on their own unless they've built a network up around them.
Of course.
So yeah, I think we're just talking about you just everyone back on the road.
Oh, isn't it?
Fix all the problems.
Anyway, let's go back to the 80s. Okay, is there anything else that you feel that you'd like to discuss that we haven't actually mentioned that you think is really important? So actually, just two quick ones. Do you think there's a rise in kids with celiac disease? And do you think there is a rise in kids with autism spectrum disorder? Or is it just that they weren't diagnosed years ago?
So celiac there's a... Dad's celiac. Genetically, it's an environmental trigger in a genetically programmed person. So there are tissue types of people that are likely to get it, and depends on whether or not they feel there's an outbreak of a virus. You know, sometimes that triggers it. It's probably not a rise in it. I think 1 in 100 Irish people are celiac, and if you go looking for it, you'll find it. Yeah, for sure. The autism is tricky because autism is like a catch. It's like 200 kinds of autism. Autism is like the way cerebral palsy is it's a description. Mm-hmm. So there's a big spectrum there, and there's probably lots of different diseases or reasons why children have autism. And there's genetic reasons. Say there's underlying is probably a lot of them. And
as in genetic?
Yeah, you can find the genetics for some of those children.
Okay.
Some of them, like less than 10%. And depending if they're more severe, you're more likely to find something. And then there's syndromes associated with autism. So autism is more than one disease. And then maybe the milder end, the milder autism stuff, there's probably much more diagnosis of that, for sure. Because we're more aware of it. You know, before people were just a bit quirky. Yeah. Or they just didn't talk for a few years and nobody really noticed. Yeah. Yeah, you might find that children with a diagnosis of autism, their dad might have, he didn't talk to, he was 3.
Okay.
And you're like, oh, okay, well, that's isolated speech today, or did he have mild autism as a child?
Okay. But they often say that those spectrum disorders, whether they're whatever end of the spectrum it can be, that there is a genetic component. There's an awful lot more ADHD diagnosed now, or we're a lot more aware of it as well. Are you seeing that in your area?
You need to get an assessment to be diagnosed. Yeah. No, I think the reason that we don't have as much diagnosis in Ireland is because they don't have access to the assessment. And people are I think you've touched on it before in other podcasts that adult ADHD is being diagnosed, but I think people are maybe more aware of it now, whereas before, God, you could probably pick out a handful of people you knew as a child who were definitely ADHD.
Oh, when you look back on who you were in school with and stuff, absolutely.
But it's really hard to get an assessment because CAMHS is under-resourced and really it's impossible.
You almost have to beat doors down, and even at that, it could be very difficult. Can you sign up privately to see a paediatrician?
Yeah, there's private paediatricians. Yeah, I'm working out there.
in the abyss?
Not myself. No, there's private in Crumlin and Temple Street, and there's private in the Beacon, some in Blackrock. Depends on what you need to see. I'd like to think that the public service is going to manage to see every child that needs to be seen. And genuinely, I think they do. If a child needs to be seen, they do get seen. It's just how soon they're seen depends on what the GP says in the letter or what the referral is or what the problem is, really. But we're being resourced better now. Like CHI, very excited about, has more staff, and hopefully you won't have to wait to see a paediatrician to be seen on time.
Okay. And if a child presents to hospital, they will be seen and admitted and looked after whether or not their parents have health insurance or not. Isn't that right?
But you don't even get a hospital bill anymore for children. So
is that right?
Yeah.
Okay.
So if you're admitted to hospital, the A&E tax doesn't go to the hospital. That's billed. That's a government tax.
Okay.
You don't actually get charged that if you're admitted.
Okay.
So it's in the last couple of months there was a recent support of launch care that you don't get a hospital bill. So,
okay, I didn't know that.
Shouldn't.
But sometimes someone might go into hospital with their child and be asked, do they have insurance? And they fill out the form, and then they'll get a letter from the insurance company saying, oh, I know what happened to me. You get the letter from the insurance company saying, well, actually, you didn't actually have to sign this because you didn't actually have to fill this out. You're actually, that you would have been looked after just as well, but now we're actually paying a bill. That I got a letter.
Yeah, and I guess that's where it's how healthcare is funded here. The hospital, when someone is admitted, will either ask the health insurance company to pay for the bill because you've insured yourself for the bill to be paid, or will ask the government to pay the bill. So our hospital will get income from private patients extra. So it's in the best interest of the hospital of you to bill your insurance company if you're paying insurance.
Okay.
And I guess, I don't know, it depends on what way healthcare goes, whether people will stop having insurance and whether all of that will be footed by the taxpayer.
Can you see that happening?
Yeah. I think if we can, I say within my own, like within paediatrics, I think.
Paediatrics, I think, is different to every other other area though, isn't it? I can't see us ever going to just NHS style.
I don't know NHS style, I don't know if
anyone want that anyway.
That ever. And also, because also you're quite restricted by we'll only give you this one.
Yeah.
They like medications or treatments, so that you should be able to, say if you want to get rid of the cold sore in your face.
Yes.
You should be allowed to go and buy the medicine. You know that?
Yeah.
And that people have, but that you may not be funded for a more expensive medication on the taxpayer's bill. But there's something about everything for free I find sometimes is... I don't know whether full free GP care, I think that would just overwhelm the service. Because if you pay for something, I think you value it a little bit more. But if I don't think you should be sent up. Maybe it's just me, but I think if you're sick enough to be in hospital, it's not like you chose to be there.
Yeah.
There not being a hospital bill is actually quite nice and quite fair.
Yeah.
You have enough, particularly with sick children, like if you have a sick child, you're already financially disadvantaged.
Yeah.
Massively.
We're not gonna write the healthcare system here.
No, I think we've got really good healthcare system though. I don't know. I think there's a tendency to complain, but I think
if you're very sick,
you're
really looked after.
To be, yeah.
But I think that if you're just like middling or not very sick or need psychiatric care or need to get an ADHD assessment or things like that, there's stuff that's really lacking. But
if you're
hopeful
sick,
that it might
you
change.
get really there's been stories where I'm like, wow, that's amazing.
That's in what was done for someone.
Yeah. Or I suppose I think what people don't understand is how many people are involved in their case. That there might be 12 or 20 doctors in a room talking about them and coming up with a plan or an idea, or will we get an opinion from somewhere else? Or there at times people get the best care in the world in Ireland. And there's people that have come back to Ireland in terms of consulting. I'm not talking about generally peds, but outside of peds, that were the best in the world over in the States and are here now.
Yeah.
Because they don't want to leave her.
No, I think it's nice to have these conversations though as well and speak candidly about them. I don't think there's any other questions. How many sore throats warrant a tonsillectomy?
Ooh, yeah, did they say 6? They say 6 infections.
Okay. 6 infections within a year?
Yeah,
6 infections
yeah,
within a
depending
lifetime?
what their age of the child is.
Okay.
So they don't want to take tonsils out on very small children.
Why?
Because when you're very small and you have a massive bleed, a really vascular bed, you can lose a lot of blood very quickly. So they're just, the risk of them is when they're that small. But they do need to take them out for obstructive sleep apnea. A lot of small baby kids will have. Yeah.
Okay. What 5 things would you ban in a home? For example, button batteries.
Button batteries.
Sweet corn. My sister stuck a sweet corn up her nose when she was a baby.
Didn't kill her though.
No, it didn't kill her, but it was right up, and I think we took her to hospital to get it removed. We couldn't get it removed.
It's really hard to get sweet corn because it disintegrates.
Yeah.
It'd be easier if it was like...
She actually shoved it, she couldn't have got it higher. It was practically in her eye.
They do this thing called a mother's kiss where they get the mum to close the nose and blow up the nose for stuff that's, that it goes backwards.
Oh, because it go back down into the throat then. Interesting. Sorry, what
but
5
the mother
things?
does 5 things. God, now these are all things that are in my house, but should be out of, these are stuff you should get put really far out of place. Liquid tabs.
Liquid tabs.
Oh my God, like one a week. You would like another liquid tab. When is it any? Now they put the clicky things, but the clicky things are too hard for people to use, so the people just leave them open. There's little...
Yeah.
So the babies bite them and then they squirt them in their eye and they get a corneal abrasion and they have eye damage and then they swallow it and they have to be admitted.
Do you pump stomachs if a child has gone in with having swallowed something like that?
No.
Okay. Is it very dangerous?
There's very few things you pump a stomach for. You pump a stomach for paracetamol within 45 minutes.
Yeah.
Which I've seen done once.
It can actually be more dangerous to try and get them to vomit it out, can't it?
The charcoal stuff.
Yeah.
Yeah. And it's absorbed already, so all you're doing is getting the chalk bits back up.
Yeah.
Granny's handbags.
Do tell.
Grannies have their heart medication.
Oh,
they'll have their little beta blockers in their handbag.
Yeah.
Should they get eaten?
And have you seen that?
No, but it's a kind of, you don't have poisonings in your house. You have poisonings in the granny. My mother's house is very safe. But I remember saying to her when there was the babies were born, I was like, get all that stuff from under your sink up. Because it's not, the grannies don't have their locks on the doors of the stuff under the sink, all the dangerous corrosive stuff. So they need. So you're actually. It's in someone else's house. It always happens. And it's always Granny's house. It's Granny's handbags, Granny sinks, button batteries. There's some iron tablets. Oh, marijuana jellies. You know those jellies. The odd time.
The cool word for them is edibles. Okay.
Oh, edibles. Yeah, those.
So do you see that a lot?
So it's not funny. It was one weekend. There was 8 children in A&E together who had found a packet of jellies, and then there's the kid that doesn't share.
Oh yeah,
it's clearly one. When you're telling us, hearing the story, there's one who took more than the rest of them, but shared them out. And there was actually three children that ended up, I think, with CT brains that were unconscious in a short space of time from cannabis jellies.
Okay, so
put them away.
But can you actually die or do serious damage from taking it, or is it just that they can sleep it off?
No, if you go totally unconscious. Yeah.
Okay.
Like you're totally unconscious.
So, okay. That's and can you explain how dangerous that is? I just want...
You're not going to breathe, but you're like, it's totally overdrugged.
Okay.
In a small... Like, I don't think an edible will kill you, but it's a small child, big volume of drug. And the same with the granny's tablets.
That's interesting. There has been cases in the newspaper recently about kids that have been admitted because they had...
Yeah, no, there was genuinely like 3 in a week.
Because gummies look like baby sweets too. Yeah. It's not like even.
And then you don't know that they've eaten them.
Yeah.
And then somewhere it comes out that maybe there's a teenager or maybe there's an adult, like in the, which is fine because there's some young parents. There's probably some old parents
of course,
as well.
Yeah. What do you do with kids that come in and suspected? Do you just monitor them?
They're monitored, yeah.
Yeah, okay.
Yeah, you'd have to protect a child's airway if they're unconscious and not really breathing for themselves.
Okay, yeah.
What else in the house? Oh, do you know what I'd love to ban?
Go on.
Do you know those walkers? Walkers that are
supposed to teach kids how to walk? Or you
teach them how not to walk. Yeah, and they spin around and then they pull a kettle. They're illegal in other countries. They're not actually illegal here. You know, the odd time you see them on a free cycle and I feel like being one of those. Do not give that to anyone.
Yeah, okay.
Yeah, they're awful. What else? There's some other things.
Why are they so bad?
Well, because they put a lot of weight through the kids' hips and legs that are not fully developed to walk when they're not ready to walk. And then they don't teach them to walk. And then they teach them to walk on their toes. Okay. And then they only cause accidents. Like I remember there was one where, imagine if you have a whole door and you have steps down to the whole door.
Yeah.
Like granite steps or something. And the whole door opens.
Okay.
And you can reach a speed of like 20 kilometres an hour and they're straight out there. They have. Okay. I've seen them. 5. I don't know if there's anything else that I'd ban.
Okay, no, you did
What do you have
granny
to make of-
sandbags, granny sinks, you did button batteries, you said walkers, and then you also said edibles. So you actually made the 5. So you've won the prize.
Okay.
Won the prize as the best paediatrician in the hot seat today.
I'd probably also say iron tablets are something that people don't think are dangerous.
Yes. Please say this.
Yeah, because there's probably loads of them lying around because you've got a toddler and then you've got your own pregnant care or an iron supplement and you've got all these iron capsules. You can't get it out of the child's system. So an overdose of iron is quite dangerous.
Okay. Yeah. Can you overdose your child with vitamin D?
Yeah.
I did have someone in once in the pharmacy. We sent them straight into the hospital.
Oh,
like the vitamin D drops are like you're supposed to put a drop on their tongue. They were using an entire dropper full. So when they came back to buy the second bottle within the week or something, I was like, what, sorry.
Good pickup.
Yeah. So, and that's when they realised that they're actually the child who was glowing because had a great tan. So can you actually is it dangerous? Obviously.
You can, but I doubt that baby's vitamin D level was that high if they were to check it.
They weren't, they were fine, but the only thing is that their vitamin D is fat soluble, obviously.
And vitamin A, you get bad headaches from vitamin A. And I've actually seen kids who've been autistic children that have been given, some of them was a supplement, it was like 3,000 times the recommended daily allowance of vitamin A. You know, those kind of more is not more.
No.
And that can give you really bad headaches.
Okay.
And I suppose if you can't talk and you've got a headache, that's probably going to make your behaviour worse. So just sometimes less is more.
Yeah. Okay.
I've seen a few high vitamin Ds. Generally, I'd say what I say about vitamin, we're supposed to take it between Halloween and Easter.
Yeah.
And people with dark skin are supposed to take it all year round.
Yeah.
You usually get it if you take super milk or the Aldi equivalent, you're kind of got
sorted.
Yeah, sorted.
Fair enough. What got you into peds?
First I did English and psychology in Trinity for a year. And then I did medicine. I went over to Australia and worked in adult ED and then kids ED. And the kids ED was just fun.
Yeah.
Loads of fun. And everyone's
they're 18-year-old adults, but...
Yeah, well, yeah. But everyone's really nice. See, the thing is, people in peds are really nice. Your colleagues, in general, are nice to work with. And then there's generally good vibes.
And kids are cute.
There's no ego.
Yeah.
You're not dealing with that kind of... So I think we do get a lot of more sensitive people in peds by the fact that we're a bit nicer. And the kids are cute. And so I actually came back to start an adult medical scheme, did my adult exams, did a bit on ICU, did a bit of medicine for the elderly, which I actually also really liked, and has a lot of constipation.
Oh my goodness, yeah, both ends of the spectrum, eh?
Yeah, and then I did a job in peds, and I just liked it.
Okay.
Yeah. My friends always say I never really knew what I wanted to do. I wanted to do everything, and then even within peds, I wanted to do everything.
Okay.
So I've landed in general, so that kind of covers
you off with everything, keeps you busy and occupied. Yeah. Okay. Emer, what advice did you give young people today?
You've had a lot of advice for the young people already. I would say, and this is what I remember going to the Gaeltacht when I was younger. We were sent off to the Gaeltacht, sent off on our own to the Irish Gaeltacht to learn the Irish, the real strict one, and I hated it. You'd be writing out letters, and my sister said to me, "You're there now, make the most of it." And she was right, and my dad would say that as well. He would always say, if you don't like that job, you might still learn something.
Yeah.
So even if you don't like your situation, make the most of the situation that you have. Because something will come of it anyway. Something good will come out of it.
Then what is the meaning of life?
It's the now. There is no stop holding out for something wonderful or epileptic, amazing heaven or shattering future that you're going to have. Like, it's the joy in the ordinary, the everyday. I think it's just taking kind of pleasure in the moment. That seems fair.
Absolutely does. Dr. Emer Ryan, you've been an absolute pleasure and a fountain of knowledge. It's been great chatting to you.
Thank
you so much.
Thank you.